Welcome to NCLEX PN exam practice test. Our topic today is gastrointestinal. Use the link in the description to download the app on the App Store for free practice tests. Number 1. In anticipation of transferring the client to a nursing home, the physician inserts a gastrostomy tube for nourishment. Which technique is the best way to determine if the gastrostomy tube has migrated after being inserted? A. Testing the pH of aspirated secretions. B. Monitoring the results of stomach X-rays. C. Measuring the length of the external tube. D. Palpating the abdomen for distension. The correct answer is C. Measuring the length of the external tube. Explanation. Comparing the measured length of tubing extending from the gastrostomy site is an easy and appropriate technique for determining tube migration. A change in pH from acid to alkaline indicates intestinal migration, but most gastrostomy tubes are too short to reach the small intestine. X-rays are expensive and expose clients to unnecessary radiation. A distended abdomen may indicate many complications, but tube migration is not one of them. Number 2. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low-roughage diet. Which food would have to be eliminated from this client's diet? A. Roasted chicken. B. Noodles. C. Cooked broccoli. D. Custard. The correct answer is C. Cooked broccoli. Explanation. The client with diverticulitis should avoid eating foods that are gas-forming and that increase abdominal discomfort, such as cooked broccoli. Foods such as those listed in the answer A, B and D are allowed. Number 3. A client is to undergo the insertion of an esophageal gastric balloon tube. Which instruction would the nurse include in teaching about the purpose of the device? A. The device applies pressure to the veins in the esophagus and stomach. B. It is used to prevent the accumulation of ascites. C. It will prevent bleeding of arteries in the esophagus. D. The doctor will use the tube to inject sclerosing solution into esophageal varices. The correct answer is A. The device applies pressure to the veins in the esophagus and stomach. Explanation. An esophageal gastric balloon tube is inserted for bleeding esophageal varices by placing direct pressure and stopping the bleeding. It cannot be used to prevent fluid buildup in the peritoneal cavity, as in answer B. The bleeding is a venous backup of blood, not an arterial one, so answer C is incorrect. Sclerotherapy is done by endoscopic procedure, so answer D is incorrect. Number 4. The client returns from surgery with an open, Penrose, drain extending from the incision. A sterile dressing covers the drain. When changing the client's dressing, which nursing action is correct? A. The nurse removes the soiled dressing with sterile gloves. B. The nurse encloses the soiled dressing within a latex glove. C. The nurse frees the tape by pulling it away from the incision. D. The nurse cleans the wound in circles toward the incision. The correct answer is B. The nurse encloses the soiled dressing within a latex glove. Explanation. Soiled dressings are enclosed in a receptacle or container, such as the nurse's glove, to prevent the transmission of infectious microorganisms. A clean glove is used to remove soiled dressings. Tape is pulled toward the wound to prevent separating the healing edges. Wound cleaning should always carry microorganisms and debris away from, not toward, the incision. Number 5. Several of the college students' friends call the health service because they are concerned about their own risks for acquiring hepatitis A. To prevent the spread of hepatitis A, the nurse correctly advises that close contacts receive which medication? A. An antibiotic. B. Hepatitis vaccine. C. An anti-inflammatory drug. D. Serum immunoglobulin. The correct answer is D. Serum immunoglobulin. Explanation. Immunoglobulin, formerly known as gamma globulin, is made from pooled donor serum containing ready-made antibodies. It is recommended for post-exposure to a person with hepatitis A. It is most effective if administered from 48 hours to 2 weeks of exposure. Antibiotic therapy is ineffective in preventing or eliminating hepatitis A, which is a viral infection. Hepatitis vaccinations are usually given to clients at risk for contracting hepatitis B. Anti-inflammatory drugs, such as salicylates, non-salicylates, and steroids, are ineffective in preventing the spread of hepatitis A. Number 6. The nurse assesses the client for signs of fluid volume deficit related to diarrhea. Which assessment finding is most likely to indicate that the client is becoming dehydrated? A. Elevated blood pressure. B. Dark yellow urine. C. Pink mucous membranes. D. Irregular heart rate. The correct answer is B. Dark yellow urine. Explanation. Dark yellow color indicates that the client's urine is concentrated, a sign of dehydration. Pink mucous membranes are a normal finding. Elevated blood pressure and irregular heart rate are abnormal findings, but these signs are not associated with fluid volume deficit or dehydration. Number 7. A nurse is assessing a client hospitalized with peptic ulcer disease. Which finding should be reported to the charge nurse immediately? A. Blood pressure 82/60, pulse 120. B. Pulse 68, respirations 24. C. Blood pressure 110/88, pulse 56. D. Pulse 82, respirations 16. The correct answer is A. Blood pressure 82/60, pulse 120. Explanation. Decreased blood pressure and increased pulse rate are signs of bleeding. Answers B, C and D are within normal limits, therefore, they are incorrect. Number 8. A client with pancreatitis has been transferred to the intensive care unit. Which order would the nurse anticipate? A. Insertion of a Levine tube. B. Blood pressure every 15 minutes. C. Cardiac monitoring. D. Dressing changes 2 times per day. The correct answer is A. Insertion of a Levine tube. Explanation. The client with pancreatitis frequently has nausea and vomiting. Lavage is often used to decompress the stomach and rest the bowel, so the insertion of a Levine tube should be anticipated. Answers B and C are incorrect because blood pressures are not required every 15 minutes and cardiac monitoring might be needed, but this is individualized to the client. Answer D is incorrect because there are no dressings to change on this client. Number 9. The nurse appropriately documents the administration of meperidine hydrochloride, Demerol, on the client's medical administration record and in which other area? A. Computer database. B. Opioid control log. C. Drug enforcement form. D. Pharmacy access book. The correct answer is B. Opioid control log. Explanation. The federal government mandates that the manufacturing, distribution, and dispensing of addictive drugs such as meperidine hydrochloride, Demerol, be controlled. Therefore, an accurate accounting of its administration should be kept in an opioid control log, also known as a narcotics record. Some healthcare facilities may use computerized record keeping or other forms to internally track the use of opioids, but these types of medications still need to be recorded to ensure that the drugs have not been stolen or mishandled. Number 10. 1 year after the gastrectomy, the client develops pernicious anemia. A home health nurse administers 1,000 microgram of vitamin B12 intramuscularly every month. If the label on the vial of vitamin B12 indicates that there is 1 milligram of drug per milliliter of solution, the nurse is accurate in withdrawing which amount? A. 0.01 milliliter. B. 0.1 milliliter. C. 1 milliliter. D. 10 milliliter. The correct answer is C. 1 milliliter. Explanation. There are 1,000 microgram and 1 milligram. The order is for the administration of 1,000 microgram, and there is 1 milligram of drug per milliliter of solution. Therefore, the correct volume in this case is 1 milliliter. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.